If you're wondering how much your MRI scan can change over the 14 years of time, in this video, I have a special guest, Aruna, one of my online clients who is suffering from chronic lower back pain due to lumbar disc bulges and spinal stenosis for the last 14 years. Aruna is been getting consistent MRI scan every year for the last 14 years. And in this video, I'm going to share with you how much her spine has changed over the last 14 years. In addition to that, she's going to share with you what are the things that really help her the most in regards to her pain management, and also how she managed to progress her routine and get back to the gym and train pain-free. If you're suffering from spinal stenosis due to lumbar disc bulges, this video can be beneficial for you in regards to your recovery. And if you find this video helpful, make sure to leave a comment and let us know what was the things that really helped you in regards to your recovery. If you've never been in this channel, my name is Bob. I'm a physical therapist. I help people globally through online consultation with providing them clarity in regards to their injury and help them step by step with providing them a plan that they can follow at home without any equipment and gradually build them up to full capacity. If you're suffering from chronic lower back pain due to lumbar disc bulges, I can guarantee you that there are some steps that you can take for your recovery that you've been missing in your routine. And as the expert in this area, I can guarantee you, you do have a chance for recovery. And if you never try, you never know. If you think that you would like to get a second opinion, I would be more than interested to sit down and go through your case and discuss your injury and provide you a second opinion and give you some idea of where you can start and how you can progress it. You can always book an online consultation with the link below and we can get you started right away. The reason that we're sharing this video is to just share your own story. Like, how did you end up, even contact me initially? And you can start from your own stage. Like, I suppose you had an injury that you contacted me, maybe you start from when this whole injury started, what you've been doing, and then how did you end up starting training with me?
Okay. I always have a back issue, suffering from back issues like last 10 to 15 years, but it was not so severe. But I reached a point where I came to know by MRI that I have L5, S1 compressed disc, practically no disc. So I used to take lots of, I did a lot of physiotherapy, and also I've taken lots of epidural shots. And I'm a pretty much active person. I have practically go to gym all my life, and my mom also have a history of this issue. So I always thought being active is the thing, so that I don't want to be bedridden. So I
Yes.
used to walk close to 20,000 steps a day. I love walking. That is my therapy. But when I was hit with this, I'm an IT person, by the way. I work a lot, I sit a lot, and it's not like I don't know any exercise. I know from yoga to you name it, I practically know everything to do. And
Yes.
they said that the core exercises I need to do. Then once I got this issue and I finished the physiotherapist, they said to me that we can't help you anymore. You need to do surgery. That's what they told me. And they said, and also I visited, he's a good famous doctor anyway, but I had a 2 months wait time to get the surgery done. And they told me to do lumbar fusion.
Yeah.
And also visited India, and even there also I was told to do lumbar fusion. It's basically getting a duct tape and I cannot move past certain things. So then I started listening to a lot of books, and a lot of spine surgeon books who has written, and no matter what, I could not recover. And I went through so many YouTube videos, and whoever with spine related about the recovery, they say I list down all those exercises. And like that, I started doing, and the pain became more and more. And I was in a very, very bad shape. And
And
one
when
day,
was that?
somehow,
I don't know. Can you maybe go back on time? When did whole start? Like when you're back, what year was it? Since when that pain got bad?
It got bad since last year of June, July, it started very, very bad, extremely bad. I used to, and the sciatica pain was so worse that I want to cut my leg and throw it away. And I cannot sleep. I used to have a couple of pillows. I always sleep on the side. I cannot sleep, practically sleepless nights. I was very depressed, and I was always on the, very sad. I cannot, along with that, I also have plantar fasciitis added up. So I cannot wear, no matter what type of recovery shoes I wore, everything added up. Basically, I thought that I have wished so many times that why I'm alive. That much it was pain. I could not smile. I cannot go to any parties. Forget about parties. I can't even
See friends.
I can't even want to recollect that.
Yeah.
But anyway, I was watching this YouTube video, and I always believe in my own spiritual thing that my mother-in-law told me that you need to visit one temple 5 days, 5 times, 5 Saturdays, and do this thing. So I visited and I came back, and again I'm always obsessed with looking how to fix this, because I'm a person, if it comes in my mind, I do it. I never give up. So the hands of my physio guys showed up in the YouTube, and also I heard a couple of stories about who has gone through the same issue. Some are younger than me, some are older than me, and they have they have much more complicated issue than me. Somehow I could not believe that. Whether they have cooked up the story, I was a little bit doubtful, honestly. Then
Initially.
thought like, somehow I believe in my instinct tell me, no, what you got to lose? Just 1 hour, get the consultation. At least he will say yes or no, and I will then I uploaded all my MRI and everything to your site and got my consultation. The thing I went with you, honestly, I picked you was you read all my details of every single file and looked through all my images and explained me and I was so worried about my stenosis, because I was Google and stenosis. I was thinking I was severe stenosis. What kind of, then you explained me that I have forminal versus central, not central. I like that. I don't think the doctors even mentioned that in-depth detail that you did to me, Bob, honestly.
Initially,
I am very grateful. So
Thank
when
you.
I started the journey, then I like the way you give me exercises, and you also, I think you nailed in 2.5 weeks, you nailed my problem, saying that I'm doing too much. You are walking too much. So you cut down my walking. And also I'm obsessed with thinking that if I don't walk too much, then I may not lose weight, or again my pain may. So I think that was the starting point of my healing, and that reducing the walk. And then slowly we worked on all the mobility exercises. Then as such, there where the journey began, and I'm with you for 6 months now, and also I learned how to manage my stress. You have told me what stress triggers me, as well as I can itself click and say, okay, Bob told me this, and always, more than anything, you are available 24/7. It's not like if I have a question, I can message you in WhatsApp, you respond back to me. Even in case if I am not even responding, you check up on me how I am doing. Either when I went on a vacation in Cancun or India or something, you always check up on me. And so that makes it much easier that I have 24/7 help to get my answers.
Of course. Okay, Aruna, let's say, for example, I think one of the impact that you had from visiting your orthopedic and a surgeon, was that negative impact in regards to your MRI scan and the stenosis that you mentioned. I think it would be good to share with people who's watching this video what happened, you know what I mean? Like in regards to your injury, because you end up getting an MRI, right? You had quite a long history
I
of
have 3 MRIs done. 3
yeah,
MRIs.
but but I think you've done MRI quite regularly, right? For
Regularly, I
sorry,
do
yeah,
like, yeah, regularly I do. Then they say, so I asked my doctor that some, sometimes you have to bite the bullet. That was the exact statement given by the doctor. You have to bite the bullet and have the surgery done. That was the exact
quite a
statement
very
from him.
hard language, right? Like I think, one of the toughest part of the whole process was that for you, you had so much doubts about your back initially that
Yeah.
it hugely impacted your stress level and even your pain.
Way too much. And I told them that, okay, I am 50, I don't mind mentioning my age. I am
Yeah,
55 years old. So if I do the surgery now, is that it? Then I don't need to do rest of my life again. I don't care. I don't need to bend past L4. Is
yes,
that it? Then I will make a decision. Then they said to me, promise me that I don't need to, I'll ever come back to surgery. They said no guarantees because L4 and L5, there is a tear there. L3, hardly there any disc. You may be coming back to another surgery in couple of years. They told me that. So I didn't wanted to start the journey at 55, do in 58 or I just, and also I don't know what are the issues after surgery. So
yeah. And I think one thing that we really covered, it was interesting because when I went through your files, you had an MRI scan over the last 10 years, every year once, just
yeah.
to insurance, I believe they get it for
Yes,
you.
because I
And
always have this issue. I used to take
yeah,
pills, do some
yeah,
extra survive, but it came to the screeching halt last year where
yeah.
they said we have to
You
do
have to do
surgery.
something. But I think, one of the interesting part was that over the last 10 years, you know what I mean, your MRI scan didn't change as much, you know what I mean?
Yeah,
Which means
that is true.
those degenerative changes that I think, they're trying to tell you wasn't really severe. And that's the truth about, things that we'll see in people with back pain because somebody who has back pain or due to the disc bulges or herniation or stenosis, they think that their problem starts yesterday or last week or 2 months ago, but those changes or degenerative changes are happen very gradually and slowly, and it does not necessarily happen overnight. And if you get sore, it doesn't mean always that you've done more damage to those structure, because I think you were asking me that, Bob, are you really sure that I can get better with the stenosis? Do
I
you
don't
remember that?
believe it because I
Yeah,
have tried, the amount of pillows I have purchased, the amount of McKenzie method. Some days I started walking like a robot, like straight, thinking that it will fix. Sitting also, you
yeah,
said don't do that. That and also I used to keep a pillow bag. All kinds of. I have so much
yeah.
equipment purchased and wasted thousands of dollars. You have no idea, Bob. You made me throw away everything. Please, everybody whoever is watching, believe me when I say this. I sometimes I believe, is it true? Sitting and talking with smiling here. That's what I
Yes,
feel,
yes,
honestly.
yes. I think the results of too much information and reading too much and seeing so many different people because of your pain was that you got so confused. Okay, I should probably use everything. I should use a brace. I should use a pillow for my chair. I should watch
Yeah,
my posture. I should
yeah.
walk different. You know what I mean? And I think all of that hugely impact your stress level as well. And you didn't trust your body as much, isn't it?
Yes, and also the way you tell me, like when I used to get stressed, suddenly I used to get the big pain in the back when I'm driving or somewhere else. You kind of told me that that is your body is, adjusting whatever. You don't need to panic, those kind of things. When I was traveling, I had not gone on a vacation for almost ever since this started, and I made a decision to go and celebrate my birthday in India, and I was like, I just took off then in the Doha airport, I kind of felt little pain. I didn't care. I did one of your some mobility exercise in one corner where in the lounge. It made
Yes.
me feel good. Then I can survive and I can sit again. Like
Yes.
me, I have traveled and even and came back. Otherwise, I was not even able to sit in a car and drive for 30 minutes. I was in that situation before.
Absolutely, absolutely. Now, I don't know if I go through, let's say, in your own words, you know what I mean? I think you highlight some, but let's say for people who are watching this video who suffer from disc bulges, spinal stenosis, and what do you think, in a short term, like let's say in a short words, let's say if you highlight, what do you think helped you to recover? You know what I mean? And be in this stage, because we managed to get you back to the gym, because I think you had a bit of doubts about training the gym. I mean, you used to train in the gym, but we got you back to train with weights, do things that, challenge your body and your back. If you
I
highlight a couple
I
of
honest
things, yeah.
okay, some of the things I would say that having having Bob, having physiotherapist 24/7, and I like the way you come up with a spreadsheet where he will say that, okay, mention your pain patterns and how your stress level, what are you doing to make you happy, what are the new things you are learning. We don't even consider those kind of things, we just do. But those kind of, we putting those data will make Bob to guide you to redo the exercises or tell what triggers you. He nails down the problem. That's the one fixed me, honestly.
Which means
I feel
tracking,
that's what it is.
which means measurable factors,
Yes, yeah, we don't get like that in anywhere we go, that detail oriented kind of thing.
Yeah, yeah. And I suppose it gives you a bit of reflection as well, that what works and what doesn't works.
Yes, yeah, yeah. Yeah, you will tell, don't do this. Is this bothering you? Don't do this. But it's not like you will ask me to do permanently remove. You always have suggested me that no, everybody should be able to do every exercise, but know your body, listen to your body. Everything is in moderation. Slowly we will build up to you to do that exercise which you love to do. That's what I
Absolutely.
like that.
Absolutely, yeah. Okay, then if I look at it, okay, having a routine and a structure that is measurable is one thing. Anything else, I don't know.
Um, And also, like, if they have, yeah, I don't know. I need to go and get my, I just, I don't know. I feel everything is positive. There is nothing that I can think. Just if you guys have any doubts or anything, just have one, hey, 30 minutes climb, just having 1 hour consultation doesn't hurt you. If you don't believe in a person, that's fine. If you think, just have 1 hour consultation with Bob
Absolutely,
and get your,
absolutely.
so yeah, and it is nothing like you feel you are going to the, you are in the Zoom call. He even watches your exercise, how you do, and you can even do the, if you do videos, you can send him and he will always tell you did wrong. He will watch you when you do the exercise. What more,
Which means
you know?
getting a kind of like a, I suppose, coaching and
Yeah, coaching and and also for the people who are watching, whatever exercise Bob recommends, there is a link next to it where he will clearly tell you how to do the exercise. Not like, no, cat camel, not like, hip thrust. There is
yeah,
a
of
link
course.
for each exercise. So it is like that,
You can
that
see
makes,
visual, I suppose, video. And
yeah.
I don't know, like beside the program, I think the one of the huge factors that help a lot of people is the matter of consistency of
Yes.
you were very consistent with your routine and you didn't do anything beyond that. You know what I mean? You were
Yes,
very
that is true. Yeah, Bob is going to ask me, Friday is the meeting. I need to be doing it. Why you didn't fill up the data? If
yeah,
you want to
exactly.
get
Yeah,
better, because we try to fall off the wagon a little bit when I get better. It's okay. Then, then if I have, suddenly I will message you, it's hurting. So there is no data there. Then I clean
exactly.
up my act and update
Absolutely.
the spreadsheet.
And follow up basically, which means time. And I think sometimes people looking for quick fix and miracles. I always try to mention this to clients like yourself. You know what I mean? With time, when you have more data, you can analyze and understand what works, what doesn't works, and how your body respond to this. You know what I mean? And having that image and picture that I can get better, first of all, and having a bit of commitment to that plan, it hugely changed the game. Don't think so?
Yes, that is true. And also after again, I signed up because now we are working on the gym routines, all the machines to use, going back to the gym, building strength, yeah. So we are in that part of the journey. And I like the fact that I love going to the gym, and I'm not doing major deadlifts or nothing as of yet, but I'm doing all the other exercises. Yeah, yeah, building my strength. now. And
Absolutely, absolutely, yeah. But that's brilliant. That's brilliant. I don't know. Is there anything else that you like to share? Like anything else that you would like that we haven't covered yet? Because we are going to get you to a kind of like a new routine now that you're starting in the gym, more consistent. Your symptoms are much more manageable right now. You literally, let's say, if you make a comparison from where was the symptoms and how's it right now, how would you differentiate them, just for people to know?
I am, I'm more comfortable, I'm more confident to do any exercise.
Exactly.
And yeah, you always tell me to do whatever works. Although sometimes you might have given range 50 lbs or 80 lbs or whatever, but yeah, I'm very confident. I listen to my body and I know your words. I get whole 1 hour, or even if I want to, you talk to however long I want to in
Of
our
course. Yeah.
calls. And yeah, you really answer all my questions. There is nothing like it is a quick call or nothing of that sort.
Of course.
Practically, we get all questions answered. So although I'm talking again in next time with next meeting, but still I have everything in my head to function and do my
Exactly.
things wherever I go, actually. Uh,
Absolutely. And I suppose,
and also, you also one more thing I didn't mention for the when I was depressed and sad and hurting or anything, I withdrew myself by not able to don't want to go anywhere, show my sad face, and because anybody, hey, how are you? I said, you get tears in my eyes or whatever. But you tell me that when you're hurting is the time you guys have to go outside, hang out more, and do the normal. That statement hit me. Do the
socializing.
things which you used to do. Go, Aruna, don't do this exercise here. Go to the gym. If you love, you used to go before to the gym, go and do the same exercise in the gym and come back. Because you said that do the normal routine every day, what you love to do. That makes you heal you better. Yeah.
Absolutely, absolutely. And I think, that part is like socializing with your friends and secular friends who support you is hugely important while you're having pain. Because I think with chronic pain that you've been experiencing, one of the things that cause it's isolation, which means you stay at home and you feel like depressed. But to be able to reconnect with people and spend time and be outside of the house and be part of the community, that hugely impact pain, which is I can see that is part of our life. We don't want it to stay alone. You know what I mean? Let's look at it that way. And I don't know. Thank you so much for the time. I'm delighted from where you are right now. I couldn't be happier because you initially you had so many doubts about your recovery, and I think right now you're in a better place. And the other thing is that you learn about your body, which means you don't panic with just getting some sort of flare up here and there, because flares up is part of the routine, part of our life. You know what I mean? And it can impact it with different things, such as sleep, stress. You know what I mean? Doing too much, doing too little, and you learn all of that much more with clarity. I appreciate
Yeah.
your time and thank you for trusting the process and sticking to the plan.
Thanks so much, Bob, for all your help.
As I promised at the start of this video to share with you what was the changes in her MRI scan over the last 14 years. In this picture, you can see from 2010 to 2023, her MRI scan are quite identical, even though she was experiencing mixture of different type of symptoms over the last 14 years. One of the things that I would suggest to most of my patients who suffer from lumbar spine disc bulges to avoid get consistent MRI scan year by year. This type of information, such as MRI scan and pictures, can hugely impact your mental health and cause much more catastrophe. Research highlighted this in many studies, and we suggest patients to do not get too many MRI scans because it can really cause more problem and cause more fear of movement for patient. Aruna was similarly to many of you guys who had MRI scan, was quite panicked and feared about her recovery. And from the first day, I was just trying to explain to her that we do not see any changes in her MRI scan and remind her that she hasn't done any damage to her spine. That is very important for you to understand, that we don't change over time as much as we think, and our body is quite resilient. For this matter, I would definitely suggest you to don't get consistent imaging. I believe human body is adaptable and you do have a chance to recover, but if you never try, you never know. I believe Aruna was never give up in regards to her recovery, and that's why she ended up contacting me and we started her plan 6 months ago. In this video, you see what was her struggle and how she ended up getting some sort of pain relief and understand her symptoms much more. This is all based on science and there's no shortcut. If you think you can follow a plan and stay consistent and don't give up, I believe I can help you to recover too. You just need some more clarity and guidance, and by following a plan that suits your injury, I believe you do have a chance to recover. If you think you would like to book an online consultation, you can use the link below and we can get you started right away. If you find this video helpful, make sure to subscribe my channel for my weekly update. Make sure to like this video and share this video with your friends and family. Until next week, all the best.